Okay, so I've been asked to run through the admission process on an inpatient setting. So the process starts with the crisis team screening and admission, and they will give you the heads up that the patient's coming. At that point you'll be able to look the patient up on care notes, obviously if they're known. When the patient arrives, obviously we want to give them a very welcoming, reassuring entrance to the ward, and if they're detained, then at that point we would be accepting the section papers. There is a checklist on the wards to assist you to do that. We would always put an admission on eyesight observations until they're regraded, and that person who's been allocated that task would be the person who could orientate the patient to the ward and show them round and look at the activity timetable, and things like that, show them the allocations board, all the things like the routine. They could run through that with the patient. While they're doing that, you can call the duty doctor, give them the heads up that the patient's arrived and that you would like them to come over and do the assessments. You open the episode up on care notes, ask the person doing the observations to do the 132 rights or the informal rights. You can replan the risk assessment, so that's about reassessing the current risk, because we know that generally risk is likely to go up on admission. You can complete the care plan and make all the necessary telephone contacts. So, for example, if I had a patient who I thought needed to be seen by the district nurse because their skin was looking a bit red, or I needed a pressure mattress, then I'd be making those phone calls, next of kin, all the people that you think should be contacted. Then hopefully the doctor will have arrived, and they conduct the adult mental health assessment and the physical assessment, the VTE form and the capacity assessment form A. And then you would make sure that they were started on news and do a food and fluid chart, and then completion of the property disclaimer, so looking at what property they're coming with and recording. There's a checklist to help you, very simple checklist that's really puts it in black and white, and then it will also then guide you to what needs to be done within the next 24 hours. So, for example, an MSU or an ECG and an ECG, and then what the primary nurse needs to complete in the next 72 hours. And that's it. It's easy.